This is the radial scanning technique. So this notch of the transducer faces the nipple and the probe moves around clockwise starting at 12 o'clock all around the breast. This usually uses pivoting motions of the wrist as we need to keep rotating it. Now you can do this for contour and content, so you can go all the way around again. This can be divided into sections, so now we'll move towards the periphery of the breast. You can divide it into as many sections as you need to make sure we've overlapped. Now starting at 12 o'clock again and keeping that notch facing the nipple, we are going to go all around the breast, scanning in a clockwise direction until we reach back, ensuring we have overlapped. Now with this scanning technique, the axilla can commonly be missed, so we have to make sure we thoroughly scan that. This is the anti-radial scanning technique. Now with this scanning technique, the notch always faces the patient's right or the patient's head, and we're going in a clock face pattern around the breast. So we're starting from the periphery at 12 o'clock, coming from outer to inner breast. Now we're going back out for 1 o'clock, ensuring we've just overlapped with the previous 12 o'clock and coming in. Now we're going out to 2 o'clock, ensuring it's overlapping, coming back towards the nipple. Now we want to make sure we're really covering the peripheral of the breasts with this scanning technique, as it can commonly be missed tissue in this area. We're now going to 4 o'clock, back in. We want to make sure we're also following the contour and curves of the breast for correct intonation. We'll do 5 o'clock. Now once we've done 5 o'clock, we switch the probe around, so the notch is facing back this way, and we're going to do 6 o'clock, 7 o'clock. For the purpose of this, I am going a little bit faster. 8 o'clock, 9 o'clock, 10 o'clock, ensuring we're overlapping at all times. 11 o'clock. Now 12 o'clock, we're going to rotate the transducer again with the notch facing back towards the patient's right, and do 12 o'clock. Now with both these scanning techniques, radial and anti-radial, scanning the nipple can be quite difficult, especially with attenuation and lesions behind it. So we have to make sure that we're fanning and using different angles with a lot of acoustic gel to sound penetrate and see any lesions or pathology behind the nipple.